We're going to begin today with news of a sudden surge in the number of coronavirus cases in China. A surge reported just hours after the Director General of the World Health Organization warned the outbreak could go in any direction. Now, health officials say the jump is likely due, in part at least, to the way the illness is now being diagnosed, the illness now known as COVID-19. We'll talk about new methodology in just a moment, but first, let's look what these new numbers are telling us. 254 new deaths reported yesterday. That's almost 2.5 times the previous daily record, and it raises the overall number of fatalities to 1,365 in mainland China. Still, the only other 2 deaths outside of mainland China, one in Hong Kong and one in the Philippines. The increase in confirmed infections in China is even more dramatic. It's up today almost 33%. The total saw a spike of over 15,000 yesterday and now has climbed to almost 60,000. There are more than 520 cases globally, including 6 here in Canada. We're going to lead off our coverage this morning with Bruce Harrison, who is with us live from Hong Kong today. Bruce, behind the mask in a very isolated part of Hong Kong, as are the measures. And of course, this just underscores what we're talking about today, Bruce. But tell us about these new numbers. They are startling on the surface for sure.
Good evening from Hong Kong, Heather. Yes, a drastic change in what appears to be the way that they are testing and diagnosing coronavirus patients in Hubei province, in Wuhan. Previously, they were using diagnostic tests that experts are now saying vary in levels of quality. So they have made a shift, and on top of these diagnostic tests, we're now seeing CT scans being used to identify infection within the lungs, and it appears that may have boosted the number of confirmed cases of coronavirus, specifically within that province. It's quite a jump, as I said, and at this time we're going to see a combination of both those tests moving forward. There has been some criticism as well. Some people are saying that kind of testing, the CT scans, isn't necessarily the most efficient or accurate either. But because of the severity of the virus outbreak, they're trying to do whatever they can to get the people that need treatment.
Bruce, I want to bring in some pictures here, pictures that are just moving, showing some activity there in China of military troops by the thousands, more already, many there, of course, dealing with the coronavirus, but many more now arriving, moving into position. I know you're going to talk about that and some of the other government and official moves we're hearing about today, essentially a bit of a purge of officials who have handled this crisis or perhaps mishandled this crisis.
That's right, Heather. Xi Jinping is stepping up his efforts to try and contain the spread of the virus and reassure the people of China that he has the situation under control. Military personnel is one option. He's also announced he's going to send 2,600 medics to Hubei province to enhance or bolster the efforts there by the medical staff already on the ground. We've known for a while at this point that they have been shorthanded, not only personnel, but supplies lacking as well. And you mentioned officials. Yes, there has been a purge of sorts. The head of the Communist Party of Hubei province, Zhang Jialing, was replaced by the former mayor of Shanghai, a man named Ying Yong. Xi Jinping has a history with Ying. They go back to his days before president. And it appears that he's trying to perhaps replace some of these individuals to send a signal that he has the situation under control. It could simply be a fact that in times of crisis, somebody has to bear the burden of the crisis reaching a new level, especially what we've seen in the last 24 hours with this spike in numbers. And maybe this former head of Hubei province is a man who's going to take the fall for that.
Bruce, thank you, and we'll certainly keep updating new information with you. But while I have you there, we haven't had a reporter in Hong Kong for a few days, and I'm just seeing you there. I'm seeing you wearing a mask even as you work, do your journalistic work. Everyone I'm seeing in the background wearing masks, but it also looks like there are very few people in the background. It looks like it's pretty quiet. What is it like in Hong Kong right now?
Well, it is much quieter, Heather, than it has been. Tourism has taken a major blow because of the coronavirus. When I flew into Hong Kong a couple of days ago, I couldn't believe how quiet it was in the arrivals terminal. And the same for the Shenzhen neighborhood I'm in right now on Hong Kong Island. You walk by the bars, you walk by the restaurants, there's very few people sitting inside. There's none most of the time sitting outdoors, which could risk greater exposure to people walking by and perhaps getting coughed or sneezed on. So everyone's taking precautions. It's hard to see people in this part of the city without a mask on right now.
Bruce, thank you. Just wanted to get a little scene setter there as we say goodbye, but thank you for all of that latest information. Bruce Harrison, who is live with us in Hong Kong this morning.